welcome to Stand Up for Doctors. I'm your host, Kim Downey. Thank you very much for joining us. I'd like to welcome Dr. Mark Smiley and Dr. Ramin Rafie. Thanks for joining us today, Smiley and Ramin.
Thanks
Thank you
for
having us.
Okay, you're very welcome. By way of a very brief introduction, because I want you guys to introduce yourselves, Smiley is an ER physician, investor, and CEO at Beyond Equity Group, which we'll talk more about shortly. And Ramin is a primary care and hospice physician, a healthcare consultant, and leader. And today we'll be talking about how during our Medicine Forward community gathering, you both shared about the environments that you grew up in. And your paths are very inspirational and have formed the doctors that you've become and the impact that you're passionate about making. And when I suggested this as a topic, Smiley agreed and said it's fascinating how both your environments have influenced the doctors you've become and how your work in healthcare in turn impacts the environments that your patients live in. So it's like a beautiful circle. And we thought there's some synergy between the two of you. So I'm really looking forward to this conversation. And as we get started, I always ask what you'd most like our audience to know about you. And Smiley, would you like to go first?
Yeah, well, Kim, I appreciate you inviting me on a podcast and Ramin for being here. I'm Mark Smiley, go by Smiley. I'm a father, I'm a husband, I'm an ER doctor, and I'm also the CEO of Beyond Equity Group. So I'm from Jamaica originally. My parents and I moved with my siblings to Brooklyn, New York for a better education. And at the time, we moved into a really rough neighborhood, right? So it was filled with drugs and gang violence. Fortunately enough, my father did construction for a company that built affordable housing. And so they gave us access to live sort of on an island in a really rough neighborhood where on that block it was filled with nurses, firefighters, people who were really upstanding citizens. And that really just changed my life, it changed my trajectory for so many different reasons, and even how I see medicine and business today. So through Beyond Equity Group, which I'm the CEO of today, our goal is pretty simple. We have three missions. We invest in affordable housing, apartment complexes. We educate doctors to be able to have access to these things so that they can have income for their family, and can impact the community. We want to increase the amount of affordable housing that's in the community. And then the third thing is, which I'm really, really excited about, and that ties into some of what we're talking about today, which is how does housing impact your health and vice versa. So I'm excited to be on a podcast today, and I appreciate it.
Well, thank you. I love that story. And Ramin, what would you like us to know about you?
So I grew up in Los Angeles. My family immigrated to LA in 1980. I went to UCLA and was fortunate to get into my number one choice, UC Irvine, for medical school. It was a pleasure and a true privilege to go to medical school in Orange County, which is known as the American Riviera. Um, During my time in medical school, my father was diagnosed with Parkinson's, and my father had been a dentist. He struggled for over a decade to get his license, and 2 years after he got his license, he got Parkinson's. So he never really worked. And that was during my time in medical school. And even though I was a neuroscience major, I chose not to become a neurologist. I went into primary care. Out of residency, I got a job in Michigan for a company making house calls. And this was the nation's largest house call company. And it ultimately became an ACO. And we proved to Medicare that it's more cost effective to provide care in the home by keeping the high utilizers out of the home. Many people may not know this, but 8% of Medicare's population costs Medicare about 80% of their budget. And those are 90% of the people that we were seeing. So ultimately, we were the largest players in the independence at home model of care, and we helped establish the hospital at home model of care. I was a very strong performer in that ACO, and even though I never did a hospice fellowship, I was chosen to be a hospice director. So I did that as well. Unfortunately, during COVID, I stepped away from medicine as my father-in-law passed away from COVID. and I got my MBA, and I got certified in AI in healthcare. And I still practice primary care. I now go to nursing homes, and I'm a hospice director for another agency. But I'm really looking to be a leader in the AI space for healthcare and help consult for companies that need physician clinical leadership and guidance for establishing AI. So I advise a couple of RPM companies, which is remote patient monitoring, but I'm always looking for new and interesting opportunities.
Mhm. Well, that's fantastic. Mark, if you would like to comment on anything that Ramin said, and then I also know that you wanted to share a story from your childhood.
Yeah, no, so when it comes to AI, I think that there's clearly going to be a lot of technology and disruption that's going to happen. And there are a lot of opportunities to improve healthcare. However, there's a lot of risk in there as well. And so I think it's fascinating that, um, you're going down a road of being able to communicate medicine effectively while using AI with that, because I think that's very critical. Which sometimes even goes to some of the challenges that us physicians have with just medicine in general, right? There's the business things that needs to get done, and sometimes we don't play a part in making those decisions, but it impacts the care that we're given, right? And so it's just interesting that you're going to now push down that road with AI and being a physician leader in that area. So it's pretty fascinating.
Thank you.
Yeah, yeah.
Mark, did you want to share the story from your childhood that you shared with me?
Yeah. So again, my neighborhood really, and my living environment really impacted who I am today, how I see medicine and how I see business, right? So the story is when I was 13 years old, again in Brooklyn. Um, this was a place where you didn't have a lot of parks and recreational things. And so we played in the schoolyard and we played basketball. So that's kind of what was our summer recreation when our parents were working all day, sometimes 7 days a week. So, but I remember a particular day being in the park at 13 years old. And at the time, I'm only 5'8", right? Height. But I was a pretty good basketball player. And so I played with the older kids. And so one game really turned really just rough. And, one of the older guys there didn't like how things were going. And he pulled a gun to my head. And, at 13 years old, that's what I had to experience, and that was a part of where I grew up. And I remember the day when I went to the park, I rode my bicycle there, right? And then when this happened, the entire park cleared out. And, I really believe that I'm here today for a purpose, because he didn't pull the trigger. And I tell you, I can't remember pedaling the bicycle, going back home, 5 minutes home. I can just remember being home. And home was my safe place, right? That was the first time when I truly started to think about my home as a haven, as a place that I can run to, and that a home is not just a place to live, but it's a place where stories are being created, and it's a place where people are growing and experiencing life. And so that was, that shapes how I see using medicine and using real estate to be able to really serve communities. And part of the work that I'm doing in the affordable housing space with this housing health equity work that we're doing with the health system, when I go and we're thinking about doing these, again, business principles and practicing and putting these things together, I'm thinking about the 13-year-old who needs that safe place to come back to. So again, it shapes how I see a lot of things today.
Yeah, well, that's a very powerful story, and I'm glad you're okay. And I think it's amazing the path that you've taken. So, thank you for everything that you're doing. And Ramin, what would you like to say to that?
I think Mark's story is very powerful, and we all have our own unique experiences, and I think it's very powerful. And I give Mark a lot of credit for taking action on the experiences he had and the opportunities he's providing with the equity housing, I think it goes to show, even as a physician, there's so many other things you can do outside of medicine. There's no boundaries. The boundaries are only your imagination.
Mhm.
And I applaud Mark because obviously people like Mark are the one that moved this world forward.
Well, I appreciate that, Ramin.
Yeah,
Sometimes,
that's
some days when you're in the trenches and when you're dealing with sometimes what it feels like corporate medicine hitting you and all these things, sometimes you don't feel that, right? So being able to discuss these things, it's a good thing. So I appreciate your words.
Right.
well, and I'm a grateful patient and I appreciate both of you. So thank you very much for everything that you do. I'm wondering if you'd like to speak a little bit to what has helped you overcome the challenges that you faced in your life.
Well, for me, growing up in LA, we pretty much lived off of my mom's income as a manicurist, and LA is a tough place to live. It's harder to live off of a manicurist income. So I always felt, if my mom could support the family, there was nothing to me working the 30-hour shifts. So that was really my motivation that pushed me through all the dysfunction. When I first became an intern, EMRs were just starting to populate. I remember seeing 20 minutes for the patient, and then we would spend over an hour trying to enter the information in the EMR. And we would tell all the hospital leadership how dysfunctional the EMR is, and all they did is put their hands up because it was so new. And likewise, even when I did the house call company, initially we were on paper charts, but then they adopted EMRs, and that was a big headache. And I'm cautiously optimistic that AI has the opportunity to help reverse a lot of the damage that the EMR has done to healthcare. Um, but yeah, I would say my motivation is just my mom's hard work for pure grit and just putting the time and just moving forward and powering through, and it's helped me get where I am in life.
That's beautiful. I have to say, I was working in the nursing homes, I'm a physical therapist when the EMR was introduced, and I feel your pain. I lived it too. It just changed everything and not in a good way. And
Right.
it was very, very stressful for me as well. And I didn't want to be wheeling around a computer with my stool. You just want to be looking at the patient. So I really get it. So Mark, if you wanted to share anything as to what Ramin said, or what has helped you overcome challenges.
Yeah, no, similar to Ramen. So, when I moved to Brooklyn, my dad worked seven days a week, doing construction. He was on a construction site for 12 hours a day, most days. My mom worked um odd end jobs, really just to kind of make ends meet. And so, um, similar to what you said, Ramen, being able to see what they had to overcome to give us opportunities. Um, and I see it as this is sort of easy compared to what they do. And so that motivates me when I think about parents like what we have, and then people who continue to struggle in the community today that way, right? As much as we have all these resources, there's some people who don't experience those resources. And so being able to fight for those people is something that keeps me going every day. It drives some of how I look at business and how I look at medicine. And so, and then my faith as well. I believe I'm here for a reason, right? My life has a purpose, and I'm here to exercise that purpose. And it's through thinking about serving others, really,
Right.
it is. And so, um, it's a privilege to be in a seat where, Ram and I, we have MBAs, we have a medical background, and so we can be creative and innovative to solve some of these complex issues. So this is a privilege compared to what our parents had to go through for this. So yeah.
Mhm. Yeah, Ramin, if you'd like to respond to Mark, and then if you wanted to share a little more of what you're doing as a healthcare consultant and leader.
Um, well, I appreciate Mark's work, not just in medicine, outside of what he's doing with housing as well. I think, we're at a very interesting and pivotal time in healthcare and in the history of this country, to be honest. I think, when I became a doctor, I was an attending before there was an iPhone. I tell my kids, when I became a doctor, there was no smartphones.
Mhm.
Obama was not president yet. The
Mm.
Affordable Care Act had not happened.
Mm.
And we're at the precipice of possibly having the first female president. Who knows? We'll see if that happens. But regardless, as a part of the Affordable Care Act and the public perception that healthcare is a right and not a privilege, there has been a lot of public funding of medical schools. I actually, just before we got on this podcast, came across an article that Bloomberg, besides, he donated a billion to, I think, Johns Hopkins, he now donated 600 million to 4 historically black medical schools. So
Mm.
Howard University, Meharry Medical College, and Morehouse, and one other school, Charles Drew, are all getting over $175 million each.
Wow.
So that's a tremendous push that he's recognizing. So I think
Yeah. That's really wonderful. And I actually spoke some time ago with a physician who works at Howard or with Howard on research sickle cell disease because that's been historically underfunded. So that's really exciting to hear that. Thank you for sharing. And Smiley, if you wanted to go ahead.
Yeah, no, I mean, you know, when you talk about funding um, underrepresented communities through whatever we're talking about doing, or just the doctors that needs to move more doctors like that and need to move into the space. I think these things have so many long lasting impact, right? One of the things that sometimes, so I'm an ER doctor, right? When I'm in the emergency room and someone who comes in who is homeless, I can sit there and sort of think, okay, what are the small things that I can do to make a difference in this person's life? And sometimes it's as simple as giving them a pair of socks and allowing them to sleep,
Mhm.
a reason to be there for an extra hour. That small little thing, gesture. Sometimes it comes from these lived experiences that we have, right? And sometimes these neighborhoods, and so being a physician that is in a position to make a change, it's sort of like important. And so when someone allows these schools, these historically black colleges and medical school to put through students, there's additional, I think, benefit that the entire medical community like receives. And so that's interesting that you brought that up, Ramin. So I love that. And so there's so many directions we can talk about with those things and the cost of schooling and how that impacts people going into primary care, maybe, right? All of these things, so many factors there. Yeah.
absolutely.
Mhm. I have to say that it's beautiful the work that both of you are doing, and that you didn't forget where you came from, and you're using that as an impetus to support your patients. Because I know some would say like certain physicians that have worked their way up to like the C-suite or something, right? Like that's the thing that you hear sometimes. Oh, they forgot where they came from, and just to hear your stories, it's just really inspiring. Raman, was
Uh,
there anything else you wanted to say about AI and your work with AI and how you feel that's going to help either the good things or your concerns about it?
I just think, AI is not only here to stay, it's going to lead the change. And for practicing physicians, physicians that use AI are going to replace the physicians that don't use AI. I encourage every physician out there to get educated on AI. You guys can look up my LinkedIn profile. I actually have done a couple of podcasts with Heather Fork about AI in medicine. I've provided a ton of free resources out there about AI in medicine. And there's aimed.org, which is American uh, ABAIM which is the American Board of Artificial Intelligence in Medicine. And they offer a 2-day virtual course that's not on demand, it's actually just virtual. And it's $600, but I encourage physicians to be educated on AI because AI actually has a lot of blind spots. You have to learn how it works, and it's never going to replace any physician. It's going to augment what every physician does, but you have to know how the mechanisms of how AI works so you understand that ultimately the data sets that fed into it is what it's going to learn. And the US has an extremely heterogeneous population, people from every walk of life. And just as African American physicians are very underrepresented for reasons. Um, there has to be make sure that there's people of every nationality being taught and fed into these AI models for it to really be an accurate system. And this is going to be an ongoing work that never ends because
Mhm.
ultimately, I think the US will lead the AI model of healthcare for the world. And as these databases become significant, just as US has led the way for pharmaceutical development in the world, the US will lead the AI development for healthcare in the world. Burnout is not limited to the US. Burnout is ubiquitous in every developed country that has healthcare. The difference is other countries, the physicians maybe have more power together and they don't have these insurance oligarchs, so to speak. Um, I think it's a very interesting time. I'm 49. By the time I get to be 65 and get to sign up for Medicare, I think the entire healthcare system is going to be very different. Um, we'll see. Ultimately, I think it's up to us to help shape that future.
Yeah. There's two things that I think about as you kind of share some of this about AI. One is a story that I read about an emergency room doctor who, sometimes we get really busy in the emergency room, and sometimes family members, rightfully so, are with the patient who are there, and they're advocating for the patient. And sometimes we need to explain the rationale behind what we're doing. And as one physician described, where um, a family member wanted to give their mother fluid because she appeared
Mhm.
dry. But the physician was realizing that, this patient had congestive heart failure and all the reasons why not to in that setting. But it was difficult to communicate it to the family member where they weren't understanding. And so the story is, he sat down and pushed this into AI and said, can you explain this rationale in a compassionate and clear way? Printed this thing out and gave it to the patient, the family member, and stepped away, cared for some more patients, came back in, and it was like night and day, right? It was
Mhm.
clearly understood. So that's one of the power, right, to immediately seeing some of the benefits to AI. And the second part is right now in the company that I work for in the system, they are utilizing an AI, it's sort of an app right now we're piloting where the doctor will in the ER will go into the patient's room with their phone, and the AI is recording, and the goal is for it to document the history. And so reducing the time that I go out and sit in front of the computer doing this, right?
Right.
Those are some of the benefits that people can really feel. But again, to Raman's point, there's so much information that needs to be fed to it, and fed all the diversity of thought and input needs to go into that. And so that's just an important piece. So there's clearly, but pluses and minuses here that we have to kind of navigate as we go forward.
The sad point is, I think as of today, only one medical school has AI as part of their curriculum. And I know the ABAIM has made a tremendous push to try to get their curriculum integrated into all the US medical schools, but they get a lot of pushback, just like business is not taught in medical schools, which is a
Mhm.
big hamstring. It's
Yeah,
ridiculous. Everything in America is a business.
right.
That should be on the first day of school. I remember one brief story I wanted to mention. We had a white coat ceremony, and the reason they brought the white coat ceremony back for us is they wanted to elevate the respect of being a doctor. One of the speakers said, "Congratulations on getting into medical school. You all took 10 years off of your life." I think that mindset is so outdated, and that whole mindset needs to be changed. The whole idea of being a martyr and that you should just suck it up and this is a dysfunctional system and it is what it is makes no sense. If you're going to be an educated person, you got to question everything and you should look to improve everything. Bottom
Right.
line.
Right. No, that's a really great point. I mean, and again, that brings me off on another little tangent, but I remember a couple years ago, when I worked for a corporate group that was leaving town short notice it, and essentially they left a lot of doctors filling holes in the schedule. And so, when you're supposed to be working, 10, 12-hour shifts, now you're working 16, 12-hour shifts, um, and feeling like this is just how things are, right? And you have to sit there and not say anything. Is again to your point, historically how medicine was taught, but it's not what's fair to the doctors as well as the patients who need doctors who are not overworked and are at their sharp point. So yeah.
Yeah. Um, I was going to say something. I forgot my train of thought.
Well, while you're thinking of it, I know I just hear over and over again that doctors are in residency are just told to put their heads down and keep on going. And we just have to talk about that. And it shouldn't be like that, that
Right.
you need to speak up.
On a lot of state license applications, if a doctor has mental health history, they get flagged and you get put in. But any normal person that goes through the system, whether you're a doctor or a nurse, which are one of the reasons there's two, you're going to have mental health issues. My medical school, we had a full-time psychologist dedicated to the 4 years of medical school. And she couldn't believe what she saw as a psychologist of these overachievers being put in these situations. The thing I was going to say is I wanted to applaud Senator Elizabeth Warren, and there's a couple senators because they are actually tackling this idea of private equity in healthcare. And this is another big topic in healthcare that needs to change and needs to go away. The idea of the corporate practice of medicine needs to go away. And hopefully, this is something else that will happen soon.
Well,
Yeah.
yes. Go
Yeah,
ahead.
and again, it takes again doctors who have, to your point about, understanding business in medical school, and because it's what you are going to walk into, right? It's the reality that you have to have some level of understanding of what is happening and why it's happening to be able to help to make a change to it. So there's so many different things about healthcare and education and even how we practice medicine today that needs to improve. And you mentioned in AI, but even coming back to some of the things that we do with some of the housing or the hospital at home work, right? Thinking about how can someone's home be used to provide care for them, and how does that impact, one, the cost of care for them, access to care. There's so many things that's wrapped up in there that I think can be improved. And how does technology
Huge.
and remote monitoring change some
Right.
of things? Yeah.
Yeah, it's gonna be a big game changer. I mean, when I became an attending, we were still on 3G phones, and now we're on 5G, and the
Right.
capabilities. I mean, people get a loop recorder that has a self chip in it, so the cardiologist in real time gets an update. I mean, this is unprecedented technology, and it's only going to get better, hopefully.
Going back, before we wind down, I don't know if you're both familiar with Safe Haven. It started in Virginia, and they passed the laws to so all mental health professionals can seek help without confidential help without repercussions, including physicians, and they're trying to expand that to every state. And just the title Safe Haven makes me think about your work with housing, right? And that the home, you know, is a safe haven. And so Mark, was there anything else? And I'm going to have you guys both share links of how people can reach out to you, but anything else that you wanted to share about your work with Beyond Equity Group?
Yeah. So, you know, I again, I have a vision that we can change how things work, right? So, housing and apartments and those things won't go away. Um, and the question is, can we make it so that people can invest in housing because it's needed, but to do it in such a way that really cares about not just the investor, but the people who live there and need the investment, right? So that's what Beyond Equity Group is really about. We're a private equity, we're a private group, a for-profit group that invests in apartment complexes, period. But our goal is we want to increase the amount of affordable housing. And what we do from that is we take some of our profits, not our investors' profits, to then go into our nonprofit that does some of these impact work, right? And so the pilot that we're working on right now is we're going to identify approximately 8 families who we identify through our hospital at home program who, again, they need the care in their home, but folks who go into their home realize that they're living in really poor living conditions and it's not sustainable. So we have partnered with a community partner who is going to be able to go in and do free repairs for these families, right? So, and then on the back end, what we're looking to do is to be able to track the health impact, right? So can we reduce fall risk by fixing stairs? Can we reduce asthma exacerbation by helping a family with AC and pest control, right? Some of the data that we know exists, we're trying to put some pilot behind it. So again, you know, it's a different way of investing. Um, and I really hope that, you know, we're going to really change how we do this. And at the same time, I like to say we're investing with people who care about their communities, right? These are doctors who are looking for good return for their family, but at the same time, they want to continue to have an impact. And so we give them the opportunity. So it's an exciting space to be
Yeah, no, I think that's fantastic. So I'll put any links that you both share with me in the show notes. How can our listeners get in touch with you?
I have a LinkedIn profile that's pretty good. My name is Ramin Rafie, Rafie. I also have a personal website, which is my first name, RAMINMD.com, raminmd.com.
Okay, and how about you, Mark? Smiley.
So we have a website. It's beyondequitygroup.com. You can go and see the way we invest, our philosophy, how our approach is. We always have different opportunities come up, so you can reach us that way. You can email me personally at smiley@beyond-homes.com, or you can find me on LinkedIn and Facebook. And you know, we're always sharing content about educating. One, it starts with education about the importance of investing, and two, the impact of investing. So
Well, thank you both. That's fantastic. And just one more quick question. Do you have advice for patients who wish to support their doctors?
I think it's very easy to take your physicians, your providers, your nurses for granted. Even my kids today, they saw a pediatrician. I always make it a point to thank all of our physicians. Saying thank you really goes a long way. You have no idea how their day is and how much dysfunction they're dealing with in the moment. And I just think if the public really wants a working healthcare system, the public needs to appreciate the healthcare workers, and the healthcare workers need to be recognized as public servants because there is a public healthcare system and there's a private healthcare system. The vast majority of healthcare workers work in the public healthcare system, and the public is not aware that there's a public and a private healthcare system. I don't think. I think they just see it as the healthcare system. And the public needs to recognize and acknowledge and appreciate all their healthcare workers because a lot of the nurses, there's a high turnover, there's a high burnout. It's a very difficult job. And if this country is going to continue to have a healthcare system, it needs to be a viable career.
Absolutely. Thank you. Mark, do you have any?
no, I mean, I want to echo some of what Raman you just said. sometimes when I see patients in the emergency room, they'll tell me how they love their primary care doctor. And sometimes I even ask myself, does their primary care doctor know this?
Mm-hmm.
Right? Sometimes we feel that we should only speak up when something is going bad, when something is wrong. And in medicine, there's so much critique of everything that we do, right? So we get to hear the negative reviews sometimes, and historically, that's how we've learned and that's how we've grown. But we haven't factored in how that impacts us and our ability to continue care. And so having a patient who really, if you like your doctor, let them know that.
Mm-hmm.
Sometimes often they don't hear it. So
Right.
I agree wholeheartedly with what you said, Ramin.
Right. Well,
Absolutely.
absolutely. Well, thank you both again for being my guests today. This is a fantastic conversation. I can't wait to share it. And in closing, to move the needle in healthcare, we all need to raise our voices and we all need to care about each other. We already know that doctors need to care about patients. Patients need to care about doctors too. So stand up, doctors, and let's stand up for doctors.
Thank you, Kim. Thank you for the invite. Thank you for the honor.
You're
Kim, Ramin,
welcome.
thank
Thanks
you.
for being my guest.
All right.
Take care. Bye-bye, everyone.
Okay, bye.
Bye.